Imagine living peacefully at age 60, 70, or even 80, waking up each morning feeling strong enough to take a walk around the neighborhood, chat with your grandchildren, and enjoy the calm, golden years of life. But behind that peaceful routine, your body may be quietly sending out warning signs, subtle, not dramatic, that, if ignored, could lead to serious consequences. Your heart is the central engine of your body, and unlike a toothache or a fever that demands immediate attention, heart-related symptoms often creep in silently. Persistent fatigue, slight breathlessness when climbing stairs, or even a heavy feeling in your chest while walking through the grocery store, any of these could be your heart sounding the alarm. What's most concerning is that many people don't realize these are danger signs. In this video, the warning doesn't come from a lab, it comes from the life experience and over 70 years of medical practice by a 93-year-old heart surgeon. He has witnessed thousands of emergency cases, many of which could have been prevented if the patient had recognized the early warning signs. Together, let's explore the 8 most important signs your heart may be trying to tell you before it's too late. So, if you care about your health and the well-being of your loved ones, listen closely. And before we begin, if you find this video helpful and want more tips on living a healthy lifestyle, please hit the like button and subscribe to our channel. Your support isn't just encouragement, it helps spread this vital information to more people who need it. Now, let's uncover the 8 dangerous signs of heart disease, starting from number 8 and counting down to the most critical sign at number 1. Let's protect our hearts together. Sign number 8, unusual fatigue. When your body speaks, but you're not listening. At age 60 and beyond, it's easy to blame every feeling of tiredness on aging. A sluggish morning, an afternoon of housework that leaves you drained, you might simply think, I'm just getting old. But have you ever stopped and asked yourself, why am I this tired, even after a full night's sleep and no heavy activity? Unusual fatigue, especially when it's persistent and without a clear cause, is one of the earliest yet most commonly overlooked signs of heart failure or coronary artery disease. When your heart can no longer pump blood effectively, the supply of oxygen to your muscles and tissues decreases. As a result, you feel exhausted, not after hours of gardening, but even after walking a few steps around the house or standing at the sink doing dishes. What's concerning is that this kind of tiredness doesn't feel like normal fatigue after hard work. It's a lingering, unexplained exhaustion that doesn't go away, even with plenty of rest. Some people describe it as feeling like they've run out of battery the moment they wake up. If you or a loved one begins to experience this kind of fatigue regularly, treat it as a serious warning sign that deserves prompt medical attention. Sign number 7, shortness of breath. When every breath becomes a quiet concern. Have you ever felt winded just walking across the room? Or had to pause midway up the stairs, not even 10 steps in, just to catch your breath? If this happens often, don't be too quick to blame aging. Shortness of breath, especially during routine activities, can be one of the clearest signals that your heart is trying to warn you. Medically speaking, when the heart struggles to pump blood efficiently, oxygen circulation throughout the body drops. In response, your organs, especially the lungs, work harder to compensate. The result? You feel short of breath, tightness in the chest, or even gasping sometimes while you're simply resting. What's important to understand is that not everyone experiences chest pain when heart problems arise. For many older adults, shortness of breath is the first symptom of heart failure or coronary artery disease. And if this sensation comes along with fatigue, swollen legs, or an irregular heartbeat, that's a full-blown warning sign that shouldn't be ignored. Sign number 6, irregular heartbeat. The human heart is equipped with a remarkable electrical control system, a silent conductor that keeps your heart beating steadily, about 60-100 times per minute at rest. But what happens when that rhythm suddenly becomes erratic? If you feel skip beats, fluttering in your chest, or sudden rapid pounding even while sitting still, it may be an important warning you shouldn't ignore. Among older adults, irregular heartbeat, especially atrial fibrillation, AFib, is fairly common but often underestimated. Some people describe it as their heart beating out of sync, or like butterflies flapping inside. While this sensation may be brief, if it occurs frequently or lasts a long time, it can reduce the heart's pumping efficiency and increase the risk of blood clots, which can lead to stroke or heart failure if left untreated. In particular, if the irregular heartbeat is accompanied by dizziness, fatigue, or shortness of breath, it's no longer something to dismiss. Don't wait for chest pain to take action. An off-rhythm heart can also be a ticking time bomb for serious cardiovascular complications. Sign number 5, swelling in the legs and ankles. In our later years, many people assume that a little swelling in the legs by day's end is normal, maybe from standing too long, eating salty food, or simply getting old. But the truth is, the body always has a reason for signaling discomfort, especially when swelling becomes frequent, persistent, and doesn't go away even with rest or elevating your legs. Physiologically, the heart is responsible for pumping blood throughout the body and helping blood return to the heart from the lower limbs. When this function weakens, as in congestive heart failure, blood begins to pool in the peripheral veins, causing fluid to leak into surrounding tissues and resulting in swelling in the feet, ankles, and lower legs. This swelling isn't just about posture or diet, it's a sign of circulatory fluid buildup. You may notice your legs feel heavy, the skin appears shiny and stretched, or pressing your finger leaves an indentation. Some people even find their shoes fitting tighter by the evening. If this swelling occurs daily, despite adjusting your posture, reducing your salt intake, or elevating your legs, it should not be taken lightly. Swelling isn't just a foot issue, it's often the silent voice of an overworked heart. Sign number 4, persistent cough or wheezing. A mild cough during cold weather or after eating spicy food can be perfectly normal. But if that cough becomes persistent, especially at night or when lying down and comes with wheezing sounds from your chest, it should not be ignored. Many people assume it's due to asthma, chronic sinus issues, or allergies, but for older adults, it may be a warning sign from the heart. Physiologically, when the heart, particularly the left ventricle, weakens, it cannot effectively pump blood from the lungs to the rest of the body. This causes blood to back up into the lungs, increasing pressure in the pulmonary capillaries. As fluid leaks into the alveoli, air sacs, it can create a sensation of chest tightness, coughing, and wheezing symptoms that resemble bronchitis. However, what makes this different is that regular cough medications don't relieve it, and the cough is often accompanied by shortness of breath and fatigue during physical exertion. The solution isn't switching to a different cough syrup, it's getting your heart function evaluated, especially through tests like an echocardiogram, electrocardiogram, ECG, or BNP blood test, brain natriuretic peptide, which is a sensitive marker for heart failure. Sign number 3, dizziness or lightheadedness. You stand up from a chair and suddenly the room spins. Or you're walking through your house and feel so lightheaded you need to grab the wall for balance. Many older adults assume this is just a part of aging or due to a momentary drop in blood pressure. But in reality, it could be a silent warning from your cardiovascular system, a sign your brain isn't getting enough blood. Dizziness and lightheadedness occur when oxygen-rich blood flow to the brain is briefly reduced. One of the most common causes? The heart is not pumping strongly or regularly enough. This could be due to arrhythmias, aortic valve, stenosis, or heart failure. These conditions reduce the heart's ability to deliver blood efficiently to the brain, leading to feelings of dizziness, disorientation, and even dangerous falls, one of the most serious complications in older adults. The solution isn't just to sit down and rest. If these symptoms are frequent, sudden, or accompanied by rapid heartbeat, fatigue, or shortness of breath, they need to be medically evaluated. Tests such as an ECG, echocardiogram, or orthostatic blood pressure measurements can help detect underlying heart conditions early. Every dizzy spell should be seen as a reminder your heart and brain may be calling for attention. Sign number 2, chest heaviness. When people think of heart disease, most imagine a sharp, stabbing pain in the chest. But in reality, serious heart problems, especially in older adults, often begin with vague sensations, a heaviness, tightness, or mild pressure in the center of the chest. Sometimes it feels like a heavy object is sitting on your chest, lasting a few minutes, then going away, only to return during physical exertion, emotional stress, or after a heavy meal. This is a classic symptom of coronary artery disease, where the blood vessels supplying the heart become narrowed due to plaque buildup, limiting the flow of oxygen-rich blood to the heart muscle. When your body demands more, like when climbing stairs, walking briskly, or under stress, the heart doesn't get enough blood, causing dull, pressure-like chest discomfort. The problem? Many people ignore it, thinking it's just indigestion, eating too much, or a pulled chest muscle. But the heart doesn't warn you with intensity, it warns you with recurrence. If you notice this chest heaviness happening repeatedly, even mildly, treat it as a serious warning. The solution? Consult a cardiologist and consider tests such as an electrocardiogram, ECG, stress test, or CT coronary angiography if needed. Early detection can help you avoid a real heart attack and keep your heart strong in the years to come. Sign number 1, severe chest pain. This is no longer about mild discomfort or pressure. Severe chest pain is the clearest distress signal your heart can send. It often feels like a massive weight, hundreds of pounds crushing your chest, lasting several minutes and not improving with rest. The pain may radiate to the left shoulder, arm, neck, jaw, or back, and is often accompanied by cold sweats, nausea, shortness of breath, or a vague feeling of panic or fear. This is not something you wait and see. This is a medical emergency. In medical terms, this is a classic sign of a heart attack when the blood flow through a coronary artery is completely blocked and the heart muscle begins dying minute by minute. The longer treatment is delayed, the greater the damage to your heart and the lower the chances of survival. The only solution at this point is immediate action. Call 911 and get to the emergency room as quickly as possible. In cardiology, there's a life-saving rule. Time is muscle. The faster you act, the more heart muscle you can save. Thank you for watching this video and taking the time to learn about these critical signs related to heart health, especially for older adults. Recognizing early signs of heart disease or symptoms of a heart attack can make the difference between living a healthy life and facing a life-threatening crisis. Always remember, your health is the most valuable asset you can protect each day. If you found this video helpful, don't forget to hit like and subscribe for more tips on heart protection, how to prevent heart attacks, and other simple yet effective medical advice. Share this video with your friends or loved ones. Sometimes a small act like this can help detect heart disease early and save a life. See you in the next video.